Welcome everyone to today's webinar, Unlocking the Power of Customer Lifetime Value for Healthcare. I am Ayla Ellison with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by turning the floor over to Rob Grant, co-founder of Evariant, to kick off today's webinar and introduce our presenters.
Thank you. Today's objectives, just going to run through them really quickly here. The concept of customer lifetime value or lifetime value has been around since the late 1980s. Payers have been using lifetime value calculations for years, and we are now seeing it used more frequently at healthcare systems. Lifetime value is a prediction of the net profit, or in healthcare, contribution margin, attributed to the defined future relationship of a patient. Lifetime prediction models can have varying levels of sophistication and accuracy, ranging from a crude heuristic to the use of complex predictive analytic techniques. In healthcare, techniques can include macro models or specific population segments. Lifetime value can be calculated for individuals or households and can address various delivery models such as providers, payer providers, or payers. Today's session will cover our approach to determining and deploying lifetime value at a level that is both effective and relatively easy to maintain. We will also include several tips and ideas for operationalizing lifetime value that will help you set up conversations with leadership on this topic. Just going to quickly review today's presenters. Suzanne Sawyer has been the Vice President, Chief Marketing Officer at Penn Medicine. Her last day was Friday. Later this month, Suzanne will join Johns Hopkins Medicine as the Senior Vice President, Chief Marketing and Communications Officer. Don Stanziano is the Senior Vice President, Chief Marketing and Communications Officer at Geisinger. Tom Hetherington is Senior Advisor at AbbVie Health. AbbVie consults with a broad range of health and life science organizations focused on reimbursement and policy, new product positioning, and channel strategies. AbbVie serves a broad range of health organizations spanning early stage through mature pharmaceutical and medical product companies. My name is Rob Grant. I'm the co-founder of Evariant. And with that, I'm going to turn it over to Suzanne Sawyer to talk quickly about Penn Medicine.
Thanks a lot, Rob. Hello, everybody. I want to tell you just a little bit about Penn Medicine. On the slide here, you see a bust of Benjamin Franklin, and that's because he was the founder of the University of Pennsylvania, which is based in Philadelphia. It was established as the nation's first university. It's also home to the first hospital in the United States, as well as the first medical school in the U.S. Penn Medicine is it's a highly integrated health system. It includes a school of medicine, 7 hospitals. We also have a large employed faculty practice, as well as private physicians and other providers on the medical staff of our hospitals. It is about an $8 billion clinical and research enterprise and has more than 40,000 employees. Penn has expanded its reach and its scale over time, and it's done that through alliances and different kinds of programmatic affiliations with other hospitals and physician groups, especially in cancer and neurosciences and other subspecialties. But I think what Penn is probably best known for is its innovation in research and applying that research to new therapies and treatments. In the last year alone, for example, research at Penn has resulted in 5 FDA approvals, including an historic cancer breakthrough with the first CAR T-cell therapy for cancer, as well as reversing a form of inherited blindness and other groundbreaking treatments and therapies. I mention all of this because the environment in southeastern Pennsylvania and in New Jersey is still fee-for-service. And Penn has focused for years and years on the subspecialty care. But as I mentioned, our networks have grown, our alliances have grown, and so has our presence in outpatient activity. So in fact, now nearly 60% of Penn's revenue comes from outpatient care. So we're in an interesting time where fee-for-service still matters a great deal, but we're moving thoughtfully to support value-based care. And the role of the strategic marketing function at Penn is important, and it has grown over the years. The team at Penn supports the business strategy that I've just spoken about, this combination of subspecialty care and advanced medicine, along with supporting our regional hospitals to provide primary care and community-based services close to home. And we've done that by using very modern marketing methods, using technology and data to help build the brand, as well as support the acquisition of the right business and then retention of that business over time. So that's a highlight and overview about Penn. I think on to Don, right?
Yes, thanks, Suzanne. I'm happy to share a little bit about Geisinger, where I've been for the last year and a half, and also based in Pennsylvania. We're a little further north and a little further west than Penn in Danville, which is in the heart of rural central Pennsylvania, and we serve 45 counties across the state of Pennsylvania, as well as a portion of southern New Jersey around Atlantic City. But our region, our traditional region, is largely rural. One of the things that Geisinger is known for has a reputation for being innovative, particularly in the space of care delivery models, and the fact that we've had a health plan since the early 1980s, and that integration of care delivery and coverage, and that will come into play later in this webinar as we talk more about patient lifetime value. A very different business case than Suzanne just described, where we are have hundreds of outpatient facilities and have for years, and are very involved in the management of our patients in their total health, but also well known, obviously, for specialty care at the tertiary and quaternary level. But some of the things that make Geisinger unique is the fact that, as I mentioned, the health plan that we've had since the 1980s, we were also one of the first health systems in the country to adopt an electronic medical record in the early 90s. And that has provided us with a great deal of data to allow us to get a more 360 view of our patient and allow us to provide care to them in very specialized ways to promote health, wellness, and prevention. And some of those programs are on the slide here. One of them, Geisinger at Home, which looks at our 5% sickest patients and sends an integrated delivery team tailored to them, care delivery team to them, to their homes, to keep them from revisiting our emergency rooms, adherence to their medications, and so forth, to reduce their high utilization of expensive services, inpatient services. We're launching a new senior-focused primary care offering called 65 Forward that will open next month in Kingston, Pennsylvania, in the Scranton market. And we've been mentioned in national media quite frequently for our fresh food pharmacy, which literally is prescribing food as medicine to patients with diabetes. And we've had significant success that has been written about in several national journals relative to reducing A1C levels and other comorbidities relative to patients with diabetes. Our overall promise to our community and our patients and members is better health for all, and that through our care delivery model, we want to keep patients healthy and help them live their healthiest lives. I think I'm tossing it to Tom.
Okay, yeah. So good afternoon. This is Tom Hetherington, and let's start by defining lifetime value. And as you take a minute to read this slide, just to provide some context here, as Rob indicated in the introduction, the marketing approaches we're discussing today have over 30 years of maturity in the retail and financial service industries. And to hopefully give you some confidence, we're not inventing anything new here. We're simply translating and adapting these well-proven approaches for the health industry. And lifetime value is a foundational component of this approach. So as you can read, lifetime value represents the present value of a customer, in this case a patient, that you successfully win to your brand. The important concept to take away is that lifetime value is, at its core, a form of economic equivalency, placing a value on all the future cash flows that come from a customer. And also, as Suzanne likes to point out to me, the last bullet on this slide is very important. Lifetime value represents a break-even for marketing investments, the upper limit on spending to acquire and retain a new customer. So why now? One current reality of our industry is the significant uptick in competition. As payers and providers aggregate and increasingly stretch their roles, competition is at an all-time high. CRM and marketing become more important, and you are all seeing the role of the Chief Marketing Officer becoming more prominent in the C-suite, illustrated by my two colleagues, Suzanne and Dawn, here today. If you consider the marketing budget as a percentage of revenue, the health industry currently lags other industries significantly, and we expect this to change. Not sure it'll start to approach double digits anytime soon, but certainly much greater than 0.6%. What we're talking about today is using lifetime value to help focus these marketing investments as effectively as possible. So let's spend a minute on the math. I'm going to build this all out here. Everyone participating on this webinar today understands the value of compounding. On the top part of this slide, let's assume that you approach a bank with $1. Let's further assume that the interest rate is 10%. You understand at the end of the first year, you would earn 10 cents interest. At the end of the second year, 11 cents, since that 10% is now on a base of $1.10, and so on. So here's the important concept stated as a question on the slide. At a 10% interest rate, would you rather have $1 now or $1.61 at the end of 5 years? You should be ambivalent. In a 10% interest rate environment, they're economically the same. In the very same way, on the bottom of the slide, if you projected out all the future cash flow streams for a patient, you could discount all of those cash flows back to today's present value. In this hypothetical example, you see annual projected future cash flows for an average patient, which actually extend many more years into the future than the 7 depicted here, by the way. And discounting each of these cash flows back to today's present value and adding them up, you see the total lifetime value of $150,000. Once again, the key takeaway here is the economic equivalency. The lifetime value calculation simply illustrates the present value equivalency of all future cash flows from a patient. Just to spend a minute on another important concept. So just explain that lifetime value is the economic equivalence for a future stream of cash flows. For a health system, what is the basis for these cash flows? We recommend using contribution margin. Contribution margin is defined as revenue minus variable costs and not considering fixed costs. As marketers, we're typically working at the margin. We're concerned about the next patient in the door, the next 10 patients in the door, the next 1% of market share. We want to know how much revenue from that next patient falls to the bottom line. And they're not so much concerned about allocation of fixed costs, since for this next patient, there is no additional fixed costs. That's why we like contribution margin as the basis for the cash flows used to calculate lifetime value. This slide is pointing out that fixed and variable costs are not the same as the accounting terms direct and indirect costs, you need to dig deeper. That said, I'm finding that many finance organizations actually have a good handle on their variable cost structure and on their contribution margin. So negotiating this with your finance organization might be easier than it sounds. Okay, putting this all together in a representative example. If you defined a customer segment as households with a decision maker aged between 32 and 65, and your contribution margin was 65% of revenue, and this calculated out to be, as you can read here, $5,114 for the initial year on average, and you built a projected cash flow stream that also takes into account inflation, and then as described, you discounted all of these cash flows back to the present value, you would calculate $567,000. Now, I am not trying to turn you all into finance experts. The key takeaway here is not the math, but economic equivalency. That $567,000 is the economic equivalent of all those future cash flows from that household, risk adjusted based on the chosen discount rate, and brought back to the present value. You'll be surprised these numbers are quite large, which meaningfully represents and reflects the true value of a new customer. Now, you can run lifetime value for different customer segments, as this slide illustrates. The starting point is always your corporate objectives, and ideally, growth targets for the next 3 years. You select the segments for lifetime value to align to your corporate objectives. So as an example, if your 3-year plan outlined growth targets for oncology and cardiology, you might start by calculating lifetime value for these service lines. If you're looking to build business and government segments, you might start with the funding segments illustrated on the right of this slide. Interestingly, when we ran lifetime value for Penn Medicine and Geisinger, the one thing that really stood out to our team were the differences. I mean, you heard in the introduction, Suzanne and Dawn really gave color to their emerging environment and competitive situation. So Penn prioritized, not surprisingly, very different customer segments than Geisinger. And Geisinger focused more on their payer business. We expect that any given organization will have a unique mix of priority segments for lifetime value that reflect the unique aspects of that organization's competitive posture. So now to shift this over to Suzanne, who will describe the application of lifetime value.
Thanks, Tom. Sure. It's really interesting as a marketer to realize how important it is to be communicating with and helping our finance leaders and our business leaders know and understand what it is that we can do to support those business objectives. And two of the things that are really core, of course, to any marketing function is to, figure out what to do as marketers. So the first is acquisition, acquire new business. So this is really where we want to target, and we want to identify potential people in our markets that might be eligible or dealing with certain different chronic conditions and diseases or health and wellness kinds of needs. And so how do we help them learn about our programs, our services, and how do we help them feel that we are the right kind of place for them amidst a whole market of many options? That's certainly true in the Philadelphia market, where there are many really terrific healthcare providers. So how do we think about acquisition to support the right business for our organization? And then the other function, of course, is to retain patients. Acquisition costs can be relatively high, so we want to be mindful about retaining those patients that we are able to acquire to be part of our network. And keeping them through life or through a period of time is really what this model that Tom was talking about, that's what it's all about. How do we engage with them once they've become patients? How do we stay in touch with them and help their experience as a patient, as a family member? How do we help support them through their needs clinically, as well as in terms of health and wellness and well-being? And some things you see listed here on this slide: appointment reminders, post-discharge follow-ups. And then it goes beyond that. The idea of predicting and anticipating their healthcare needs for a period beyond acquisition. It might be 6 to 12 months in advance, and it might be even longer, which we can take a look at through some advanced modeling. So acquisition really may include the process of positioning and branding and the initial choice to join a system for a specific program or service. And retention, obviously, is about keeping them in the system and engaging with them over time. And so this next slide is really trying to illustrate how we might do that. So Tom gave us an example of a lifetime value calculation example. And what we want to do is sort of pivot from that financial framework and say, practically speaking, how do we change the conversation with finance and business leaders so that it's not anymore just an allocation of dollars, say, for marketing as a function, but now it's really saying what's possible through this model of thinking about how to engage with the market. And so we'll illustrate that in a couple of examples in just a moment. But what we've started to adopt at Penn and at other organizations is to have this, what we call sort of a structured marketing approach to how to manage a portfolio of marketing investment. And what you see here is that there are 3 tiers to this. The top tier is what I was talking about a moment ago, the positioning and branding of a health system. There's a degree of investment that we make there, and that is to really articulate what is the differentiation, what is the value proposition of your healthcare brand. The next level, the second level, is about those market segments that Tom was talking about. It could be to highlight or focus on different clinical service lines, such as cardiac, cancer, ortho, neuro. Or it could be specific customer segments like women or millennials or retirees or employees or those kinds of segments. Or it could be markets, for example, a particular region. Don and I are both in Pennsylvania as well as in New Jersey. So we might take a look at the different markets that we serve and how we connect and engage with those markets. Or finally, it could be about what is the payer? Do we want to focus on commercially insured members or members of your own health plan or something like that? What's interesting about this level, or this tier, if you will, of market segments is that it's sort of a combination of the top tier, where you do some branding, or for example, around your service lines, but you also want to lead to this next tier of engagement. So the third tier is about engagement, and it's about creating opportunities to connect with people who would become your patients or who are already your patients, and to keep them in a retention mode over time. So for example, it might be an opportunity to call or click to schedule an appointment or download a guide or subscribe to an e-newsletter or participate in a webcast or something like that. So these are the 3 tiers that we're talking about. And the idea is to take for every segment to really begin to try to have a framework for what does each segment look like, how do we think about it now and over time. So it's sort of a multidimensional model. And as you can see on the right side of the slide, for each one of these segments, you want to determine what are those specific objectives and targets. For example, what's the mix of acquisition and retention? How do you establish then or determine what your marketing campaigns are going to be? Then, for those of you who have a CRM or who are considering having one, these are the kinds of tools that make it easier for us to connect and engage with patients over time through a system like CRM. Then that gives us the ability to track and measure and improve and optimize our campaigns with those individuals over time, and then to reinvest or divest in campaigns based on those results. So I realize that there's a lot going on here conceptually on this slide, but it's intended to say we can invest at a branding level, at a market segment level, and at an engagement level in order to manage our marketing portfolio. So I'll turn this back over to Tom to tee up our upcoming examples of lifetime value.
Yeah, so we just have two examples here that are representative, and Suzanne and Dawn will walk through them. They're using representative markets and numbers. So I would expect that any market in the country that calculated lifetime value for similar segments would actually generate very similar kinds of results in terms of the metrics and the lifetime value order of magnitude numbers we're talking about here. So with that, we'll just go to the first segment, and Suzanne, if I could, or the first example, if I could give it back to you.
All right, great. Thanks, Tom. So this first use case is about newly diagnosed oncology patients at age 50. And so what we're looking at is a life stage segment. We're looking at people who are new oncology patients and that they will have continuing needs throughout the course of their treatment as a cancer patient. And again, it's focusing on individuals starting at age 50 to end of life. And so how we're calculating lifetime value, it's based on contribution margin. It just so happens that, again, it's not really necessary to be ultra specific, but I can share with you that the average cancer patient may have a lifetime value of, say, $250,000 to $300,000. And this is based on what the contribution margin is for a patient times the number of years for this life stage. And so with that in mind, we want to make sure that we also understand, in addition to the contribution margin and the lifetime value of that contribution margin of that patient over time, we also want to understand the size of the potential market. How do we determine that? Well, in this case, we are using the number of new diagnosed cancer cases in the United States each year. That number happens to be 439 per 100,000 population. So that's about 0.44% of your population. So let's say that this is a market of 1.6 million residents. So that means that there will be approximately 7,000 new diagnoses each year in this particular market. Again, we can sort of round numbers here to get a back of the envelope kind of estimate. But as we go to the next slide, it shows the math in a bit more detail. So I gave you the high-level overview, but we'll walk through it here so you can really hopefully see the math and see how the equations work. So again, from the top, the lifetime value for a provider-only organization, meaning this is the hospital, it is not also a payer. Again, we're looking at someone age 50 to the end of life. And according to the actuarial tables, someone diagnosed with cancer at age 50 can anticipate, on average, 29 years of life. Again, it's based on the actuarial tables. So you'll see where that comes into play in this equation in a moment. So as I said, lifetime value for a cancer patient based on contribution margin on an average basis across the United States may range from $250,000 to $300,000. So in this case, we're using an example of $293,000 of lifetime value. We multiply that by the market size, meaning the number of oncology diagnoses per year in the market. In this particular market that I was talking about, has a population of 1.6 million. So the market size is about 7,000 people. So the potential value over those 29 years that I mentioned, with new diagnoses every year, it turns into being a rather large number, as you can see, $2.1 billion over that 29 years. So if our goal is to increase market share by 1%, and you can pick any number, but let's just say our goal is to increase market share by 1%. The value of that 1% over those 29 years is $21 million. $21 million. As a marketing organization, we want to make sure that we are thinking about bringing an ROI back to the organization. So the dollars required for ROI with a 5-to-1 return would be to do this calculation. And so that brings us to the maximum marketing investment over this period of time of 29 years would be $4.2 million. Now, the next bit is to say, we can spend that money in a lot of different ways. We've got a model that says find, meaning acquire, or guide, communicate, or keep, retain patients. So we're estimating for the find or acquisition part, we would spend about a third. Again, just rough order of magnitude, just saying about a third of that $4.2 million would be associated with acquisition. So the maximum acquisition budget over those 29 years for this particular market segment is $1.4 million. If you divide that out by the number of years that we're talking about, again, 29 years, it's about $48,000 per year. So deep breath. I know it's a complicated kind of slide that we have here, but the concept is really pretty straightforward. And we'll go over it again in another example that Don will share in a moment. But the point really is, once you do the math, it's really actually just the starting point of the conversation. It's the starting point for the marketing organization to say, how do we go to market? How do we choose to use those dollars? Let's say we go to finance, we go to the business leaders, we make the case that says, rather than just being allocated a marketing budget, let's give some thought to what we think the budget ought to be based on this kind of model and this kind of market. And so if that's the case, how would we go to market? How would we focus on acquisition in this particular case? And so there are many ways that we might do this. This could certainly be advertising, But we might want to do other things too, like the branding that I mentioned for Tier 1. Let's say your differentiation is around subspecialty care. How do we highlight that? How do we help the market know and understand one's strengths in this advanced medicine and subspecialty kind of market, especially in the cancer market? Or we might focus in Tier 2, which will be focused around our strengths and our resources and our programs in the cancer space. And then in Tier 3, which is essentially engagement, call or click to engage, to schedule an appointment for your cancer care. Now, other parts of financial services and IT and others have other ways of thinking about this that are a bit more sophisticated than I think we've introduced so far in healthcare. So for example, beyond advertising, beyond engagement for acquisition, we might decide to do other kinds of things. It could be things like seminars, and a lot of people online may already be doing those kinds of things, inviting people to come and learn more. Or we could do other kinds of things. We could create a portal for patients to connect and communicate with each other. Again, some of that is being done already. Or we could take some of these resources and choose to invest in the number of care managers or nurse navigators. Or we could do things like investing in genomic sequencing for all newly diagnosed patients. Is that a marketing kind of expenditure? No, not usually. But in the new way of thinking, is it something that we ought to think about? That if you say, for all newly diagnosed patients, cancer patients, we'll do this kind of screening for you, then that may be the kind of thing that helps give insight to the clinical care, but also reassurance and more information for the patient. So the fact that these expenses may typically be associated with other kinds of things besides marketing, it may be a good point to put on the table because some organizations may decide that that incremental investment in these kinds of services may be worth it to establish yourself in the market, to reinforce your position, or whatever the case may be. So now I'll hand it off to Don to explore more of the retention kind of model and how that looks for retention.
Thanks, Suzanne. And the slide you're looking at here explains a little different case. Use case 2 is a household case. And that was one we wanted to share because as we were talking about this presentation and my organization at Geisinger, where we are both a payer and a provider, the opportunity to secure an entire household as a loyal customer is very important, as it is for anyone. But we have the opportunity to do that with our commercial insurance products when we sign up a head of household who may have the entire household under that plan. And so we wanted to understand what would be the lifetime value of a household, particularly this segment here, which is an early family builder, a couple who's looking to start their family and have their first child. If we can secure that couple and make them loyal customers for life, what would the value be to the organization beyond just the experience of delivering their first baby with us? So we looked at the segment which involves early family builders having their first child, the age range being a decision maker in their early 30s, but looking out to their entire lifetime, how long we would expect them to be a customer. So we're looking at 32 to 64. Lifetime value was calculated with the integrated delivery of the care as well as the financial services and the revenue that would come from the payer side of our organization as well as the provider side. we looked at, in this market, in this hypothetical market, a 10,000 potential customers of early family builders annually, and an associated lifetime value in this scenario of $458,000. So if we go to the next slide, we can get into the math a little bit. Again, as Suzanne explained, so we have a lifetime value in this scenario of $458,000, and looking at a market size of $10,000, we're looking at a potential value looking out 33 years to when this market segment would transition into a new market segment, which would be aging into Medicare, which would be a completely different scenario, right? So in this case, looking at 33 years, and the actuarial tables are based on individuals. So looking at this this situation on an individual, $4.6 billion in potential value. Again, you could decide that your target is 1%, 5%, but in this case, we're looking at a 1% target for growth in this segment out 33 years. Based on that calculation, we would get a $46 million return if we move just 1%. So at the next level down on the slide, looking at that $46 million in value over 33 years, if we wanted to calculate the ROI on the marketing and what is the right amount of marketing investment, looking at a 5-to-1 ratio, the maximum investment over 33 years would be $9.2 million in this case. If we look at how do we determine how much of that investment should be for acquisition versus retention, thinking about 2/3 of the budget in this case going towards, or the expenditure going towards acquisition, the finding portion of our calculation, we would look at a maximum acquisition budget over 33 years of $6.1 million. So again, dividing that over 33 years, we would look at an annual expenditure dedicated to this effort for this segment of $186,000 a year. As Suzanne said, that money could be used in a multitude of ways, from the most obvious, advertising, a very targeted marketing, leveraging your CRM, leveraging direct-to-consumer demand generation tactics with nurturing and email marketing and so forth. But also, you could use it to influence the product, to differentiate yourself, and that can be a conversation with operational leaders, clinical leaders on how do you attract new customers. The example here on the slide, a new baby packet with their annual visit checklist. Suzanne mentioned genomic testing. Geisinger also has a genomic testing research program and has applied that to some of our clinical patients as well. You could imagine offering something like that to a new family. How great would it be to better understand the potential health risks of your child right at the moment that they enter the world, and then having that peace of mind of knowing all the potential of their health and wellness throughout their lifetime. So there are many ways to leverage the dollars, but the main takeaway here is understanding what is needed to achieve the desired result and how to best invest those dollars and what the potential upside is to the organization for just 1% move in market share. So with that, I'm going to turn it back over to my colleagues.
Hey, it's Tom. I just want to point one thing out here to the group, which is important. and that is playing off of what Suzanne mentioned when you start to have these conversations with finance. And that is this, that the way that finance in mature organizations makes decisions about investment is if it's big money investment, they're asking for a business case. And it's not unusual for someone in that finance organization to be running a net present value as a part of that business case. So in essence, what we're doing here is matching the way that many, if not most, organizations make decisions around investments, and we're putting marketing on par with others that are vying for scarce capital resources. So, the conversation here on this slide is, hey, do you want this $1.2 billion of lifetime value? Do you want the 1%? If that's what you want, here's the marketing investment required to attract and retain that business. And so it's not going to be unusual for a finance organization to think and talk about these terms, because it's just consistent with the way they do things today. So Rob, over to you.
Thank you. So some of the key takeaways, from the presentation today, we don't want to make it too long. We want to get to some questions. Payers have been using lifetime value for years, and we see this concept becoming more mainstream in healthcare systems over the next, I'd say, 3 to 5 years. Lifetime value needs to be customized for your healthcare system and market, but not created to be too complex and too difficult to maintain. The contribution margin and lifetime value lift associated with expected market share or segment growth is best determined with your CFO or the CFO's teams. And it's really, I'd say from what we went through, it's very much a close partnership as well, a lot of back and forth. If you also look at the concept of what we went over today, structured marketing, when you look at this, you can, craft future budgets in a multitude of different ways. You could have lifetime value as different, and so the segments associated with each, as a subset of future budgets, or you can make it maybe grow in terms of, importance and size, year over year. And it's probably, just best started off as a smaller concept and kind of growing, testing it out, getting other people on board. But again, there's great opportunity for that. If lifetime value is something you want to further investigate, or you want some assistance, please reach out to me, Rob Grant, at connect@evariant.com. We're happy to help you through this journey, and we actually have had a lot of fun going through this, both at Geisinger and Penn with Don and Suzanne. So next we want to just open up to some questions, and Tom's going to moderate. Thank you.
Great. Thank you, Suzanne, Don, Tom, and Rob for that fantastic presentation. And we will now begin today's question and answer session. So please submit any questions you have by typing them into the Q&A box you see on your dashboard, and we will try to get through as many questions as we have time for today. We've already had several questions come in throughout the presentation, so we're going to go ahead and get started with those. And the first question that came through really is just about getting how to get started. So this person wants to know, how do you get started with lifetime value? And Tom or Rob or any of our presenters today, can you provide some guidance on how to get started with LTV?
Yeah, I can start, and it's something I mentioned earlier, but it's really suggesting that you align marketing priorities with corporate priorities, and ideally to the 3-year strategic plan. So what are the corporate objectives related to growth? Do these objectives align to particular service lines? To select your initial segments to prioritize based on these longer-term priorities. The next thing I would suggest is to learn from your finance department, how do they evaluate capital investments and operating investments today? Get a hold of their standard business case template. And you want to align your lifetime value story with the same implied logic in this business case template if something like that exists. So, and then finally start the discussions around contribution margin. Like I said, you might be surprised. They might be all over it. They might have contribution margins by segment, by service line. So they just understand how far along they are in thinking about contribution margin. So those are some suggestions.
Great, thank you. Thanks so much for providing those tips on how to get started. The next question, we'd love to hear from Suzanne and Don on this one. Do you plan to roll out these segments in the next fiscal year, or is this a several-year process? So this person just wants to know how you're timing this. So Suzanne, if you could start with that question, and then Don would love to hear from you as well.
Sure, thank you for the question. Getting started has been something that has, really the first thing that we did was engage with eVariant and with Tom to help us understand how to get around this, get our heads around this challenge, how to think a little bit differently. And one of the reasons is because we've been working very closely with our finance group over the last several years, and what they have said to us is the investment that they've seen that we've applied from marketing and from the marketing budget has helped to make a significant impact in a number of different lines of business. And we were really trying to figure out what kind of modeling we could or should have to give us a little bit more of a understanding about what the approach should be. So I would say that this past year has been a real area of focus for us, really as a strategic marketing team. In terms of moving forward, we have developed a multi-year strategic marketing plan that is based on the business objectives, just as Tom was suggesting we should. So his point was, how do you be sure to align with your corporate priorities and look at the opportunities for growth? And so we've done that, and so that's how we look at each of our clinical service lines, our market segments, and so on. And so that's been really very helpful for us. I guess we think that lifetime value really provides us a more financially driven way of communicating with business leaders and certainly the finance organization in a more mature way in a business sense. It's really helping sort of the marketing organization achieve that level of maturity that a number of the other business functions have within our health system. I hope that helps. Don, do you have anything to add?
Yeah, I guess I would say that, I have campaigns out in market now that I've looked to apply this ROI methodology to in the coming year. One of the reasons we chose to talk about new family builders and couples looking to start to have their first child, start their family, is that is a segment that we are marketing at Geisinger. Those are not my numbers, but they're hypothetical, but that we shared. But the scenario is a real scenario, and the reason that's important for me to understand lifetime value is and why I was so intrigued by this concept is the episodic or the acute situation of delivering a child. The return on investment on that for just that episode of care and all involved is there's not a high ROI there typically, but that is the beginning of a family's journey with a healthcare organization. It may be their first intense experience with a healthcare organization, and getting that right and doing that well, and the ongoing engagement beyond that, or the right sort of engagement during that process, it builds loyalty to your brand, to your organization, and has implications for ROI over years and across other services and programs. So while that may be the gateway into your organization, that's not the last stop for that customer. And so the idea that lifetime value can help us determine the total return on the effort to bring that customer in was incredibly interesting to me, and I think it's going to add tremendous value to our organization. So I'm looking forward to rolling this out and testing it with a couple of those gateway services over the next year.
Great. Thank you so much, Suzanne and Don, for providing your insight there on how you're going to roll out these segments. I'm going to go ahead and jump in with the next question now. We've had several more come in. This question, Tom, I would love to hear get your input on it. But this person says that, so the question is, at these volumes, the contribution margin no longer makes sense, and they say that you'll need to add fixed costs for higher volumes, such as space, equipment, and the like. Can you weigh in on that, on adding fixed costs?
Sure.
You're the expert here, so.
That's no problem. So, it's an interesting question, which really gets to another important concept, which is just one around your capacity, right? So the first question that gets asked is, if you want to go after 1% of oncology, the oncology business, an additional 1% market share, do you actually have the capacity to deliver that 1%? So that ends up being a gating factor because you either have to find a way to deliver that capacity, or, as stated here, invest in fixed costs to expand your capacity. So I tend to think that the bigger question is one around capacity. And if you don't have the capacity, then yes, the math changes, and you're looking at a different business case. The business case isn't just about acquisition and retention. It's about expanding the service line and your role in delivering services to those segments, which is, if your aspiration is to double the size of your capacity, that's a very different business case. So absolutely a very good question, but I think it levers into the capacity question, which we didn't address in this webinar significantly.
Great. Thank you so much, Tom, for that clarification. I actually have one more question. It looks like we have time for one more question, and Tom, I would like to direct it to you. And the question is, do you typically see CLV used only by marketing, or is it used by system finance partners and for other purposes? Just would love to hear your insight there, Tom.
Yeah, I'm so glad this is the last question, because if in my mind, if the audience takes away anything here, it's that you all are the ones who are going to change the narrative in your organizations and help your organization start to think about business, new business, recurring business in a new way, and start reflecting this longer term annuity value and how significant it is, and to reshape the role of marketing in accomplishing that. So, I do think, as it relates to this question, it's driven by marketing, led by marketing. The narrative is written by marketing, but the goal is that everyone starts to think differently about the value of new business. And so it's not in any way limited to marketing.
Great. Thank you so much, Tom. I think that's the perfect note to wrap the webinar up on. And that is all the time that we have for today, but I want to once again thank Suzanne, Don, Tom, and Rob for their excellent presentation, and eVariant for sponsoring today's webinar. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.